Good day, my name is Dr. Gerald Katsamba. I'm a medical practitioner working in Zimbabwe. I work at Morgenster Mission Hospital, which is in Masvingo, a province that is in the southern part of Zimbabwe. I was one of the privileged medical practitioners who participated in the Merck Foundation Scholarship Program under the Blue Points Program, which is a collaboration between Merck Foundation and the First Lady of Zimbabwe. I managed to study a postgraduate diploma in diabetes from the University of South Wales. I studied from March 2020 to March 2021. During the time of my studies, I got to appreciate the changes that are happening in the world of diabetes in terms of management, in terms of treatment, and in terms of client follow-up, and also diabetes health education. I also got to understand and appreciate the changes that have been made in terms of the guidelines from international bodies, and also be able to relate them with what we have been doing here in Zimbabwe. I'm very thankful for this wonderful opportunity, for it also enhanced my clinical skills in terms of management of people who are living with diabetes. So during my time of study, I got to learn about the treatment continuum of people who are living with diabetes. I also got to appreciate the complications that arise when people living with diabetes are not managed well. This made me to be more committed to ensure that the treatment outcomes of people living with diabetes continue to improve in my setting. As you'd understand, Morgenster Mission Hospital is in a peri-urban setting, which means that we get to manage people who are coming mostly from a rural background. And for my patients, me going through this specialist diabetes course is a benefit for them, because they will be able to access specialist level services in their local setting. Some of my clients travel long distances to be able to come to the hospital. Yes, they have clinics in their local settings, but some can travel up to 100 kilometers to be able to come to the hospital. And this, there was a gap before, because if ever there was a complicated case of diabetes, we were now supposed to refer them further, or some of them would end up in a tertiary level hospital, which is 300 kilometers away from their place of residence. So me being trained as in diabetes will also be able to address that gap for the sake of my clients, and it also reduces the cost of them to be able to access the services. It will also go a long way in terms of reducing the number of complications that are coming as a result of diabetes. As you would understand, in Zimbabwe, we have been mostly a country that has been affected by mostly infectious conditions. But over the years, because of the epidemiological transitions that are happening all over the world, we see that there has been a number of people who are now presenting with diabetes, and they have continued to increase over the years. And even in my practice, we have continued to see that the number of admissions, and even the number that we continue to see in our outpatients department, has been going up over the years. So being trained in diabetes is going to go a long way in managing and also in assisting our clients to get quality services. Then in terms of our health system, having people who are trained in specialist courses, like for example in my case in diabetes, is going to reduce the pressure in the tertiary level centers, and also assist our clients to be able to access services in their nearest places. So training in diabetes through the funding that was coming through Merck Foundation is actually an advantage for us in Zimbabwe, an advantage for us here in Masvingo and our local and surrounding communities. So in terms of our success stories during the time of training and after training, we managed to do an inventory of the number of patients whom we are seeing in our hospital, and we saw that we have about over 70 people who are living with diabetes who come regularly for reviews in our hospital. And this made us to think that we need to have our own clinic which is dedicated and committed to managing people who are living with diabetes. So at the moment we are now at an advanced stage, though there has been some disruption because of the COVID-19 pandemic, but we are now at an advanced stages of starting this clinic so that we ensure that our clients get the best of the services, and also we improve our treatment outcomes. And then in our local setting also, we have also managed to improve in terms of how we manage our diabetes clients through discussion with doctors and nurses. From the information and the knowledge that I've gained, I've also managed to assist in the management of other complicated cases of diabetes mellitus. I've also managed to contribute to continual medical education for fellow staff members through presentations that we have continued to do over time. So at the moment, I just want to extend my gratitude to the Merck Foundation for availing this platform for medical practitioners to be able to be trained in specialist courses. As they are being trained in their own countries, it also gives them an advantage of being trained and also continue to offer services. So I want also to thank the Merck Foundation for this platform that our clients are going to be assisted through continued and even improved access to specialist services. I also want to extend my gratitude to the First Lady of Zimbabwe through this partnership with Merck Foundation that has made it possible for me and other numerous Zimbabweans to be trained under this Blue Points program. I thank you.